There's definitely room to grow, and I guess this brings in a broader set of literature that we've been working in, looking at the need for rehabilitation after surgery. What we know is that in addition to the cognitive issues, patients undergo a more profound, or often undergo a more profound psychological set of changes because they are, it's kind of interesting if we think about epilepsy surgery, they've been chronically unwell, they have a procedure and it renders them suddenly better, suddenly well. And that's sometimes described by patients as transformative. So they have this sense of the new me. Who am I now I don't have my epilepsy? There's a whole lot of new expectations, but they might not have acquired the skills or gone through the traditional processes or rites of passage to prepare them for that. So rehabilitation also needs to bring in psychosocial skills, social and interpersonal skills, maybe vocational retraining as well. How to deal with the challenges of normal life, for which they may not have had the same level of preparation that someone without epilepsy might have had. So we call this adjustment process after surgery the burden of normality. And in our unit at the Austin, we've set up a rehabilitation program that spans the first 2 years after surgery. They come back in regularly for support, and it's really psychological and social support that we're giving them. We're giving them cognitive support as well. And often the seizures are the lowest on the list of their concerns. Amongst patients after surgery, we also know there's a percentage who can actually get worse in terms of their mood. They can become quite depressed, and they might need psychiatric treatment. They might need an antidepressant, and they might need some sessions with a psychiatrist. So a good rehabilitation program after epilepsy surgery weaves in a range of different specialties. There's the epileptologist, of course, who is the primary physician, but then there might be the neuropsychologist, there might be a psychiatrist, there might be social work, there might be a range of other people. We also have a really valuable role played by our epilepsy nurse clinicians who triage the patients, ring them, check in on them, just to make sure we monitor who may be developing depression or difficulties versus who's going okay. But core to this whole process of post-operative adjustment and outcome is good pre-operative preparation.